rural communities in the Gambia face daily challenges. Families battle malnutrition driven by climate shocks and rising living costs. In riverine regions, access to clean water, sanitation, and healthcare remains limited, and unreliable electricity poses challenges for learning institutions. With the support of the people and government of Japan, UNICEF, together with the Ministry of Health and Ministry of Basic and Secondary Education, is reaching these communities and turning challenges into lasting change.
UNICEF the Gambia is deeply honored this year to implement two important projects made possible through the generous support of the people and government of Japan. One is responding to the maternal, newborn and child health crisis worsened by climate and cost of living. And the second one is transforming education through digital technology. Because of Japan's support, a pregnant mother in a remote community can reach safer care. A newborn has a better chance to survive the first critical days of life. A young child can drink safe water, receive essential nutrition support, and be protected from preventable illness. Together with Ministry of Health, we are delivering integrated health, nutrition, and wash services to the most vulnerable families in the central and upper river regions.
So far, over 1,700 children have been treated for severe acute malnutrition, and over 31,000 children have received vitamin A to protect them from illness and preventable disease. This support is restoring hope and saving young lives.
Through support from the Japanese government, we work with UNICEF to strengthen the integrated management of acute malnutrition and to strengthen community engagement. These are particular areas that we have been working with UNICEF through Japanese support in the past years, and we have seen some improvements in this aspect.
Ntoba aja tuti kabarati malatiri aja kabraba 6 months nga domoro nyin nga domono nyin kubase bara nin bite mo kay nga nyata ta dono je kato wato ndigo ne aja anita fongo balo bo fala kata do yari no fo basayo ala tento ndede fonka fo e ka ala baraka.
Nutrition alone is not enough. Mothers and newborns in rural areas still face serious health risks and limited access to clean water.
We have communities in Sierra that are in riverine areas and also hilly areas, and also they are highly vulnerable households that are not able to construct durable latrines for themselves. Japanese government came to our aid and constructed climate resilient improved latrines in Central River region to reduce the number of open defecations practicing in riverine communities.
At Bansang General Hospital, a newly renovated neonatal intensive care unit is being equipped to care for newborn babies and support mothers at critical moments. Health workers are being trained and referral systems are being strengthened to ensure timely care.
Through the support from the government of Japan and the Ministry of Health of the Gambia and UNICEF, there was a support from the government of Japan to expand neonatal care services or child health in rural Gambia, and specifically Bansang Hospital was chosen for this project. UNICEF came into the picture to help us do capacity building, because through this project we were able to train some of our nurses and healthcare workers in the hospital in terms of improving neonatal care services in Bansang. We are also able to train community members so that they can recognize the signs of neonatal sicknesses and be refer early.
A healthy start in life is only the beginning. When children survive and thrive in their early years, they are ready to learn, to dream, and to shape their future.
Because of Japan's leadership under TCAD, a girl in a rural school will now study with digital learning materials for the first time. adolescents can build skills for the future, supported by reliable, solar-powered electricity even where the grid is limited. With the Ministry of Basic and Secondary Education, we are expanding climate-resilient digital learning in 122 schools and alternative learning centers, reaching more than 24,000 young people.
We are very grateful to the government of Japan through UNICEF. We have started with the rural areas, and in this region, they are supporting 102 secondary schools and 20 alternative learning centers. All these schools, we are provided in the project with 128 smart televisions, 128 laptops with bags, 122 projectors, 16 servers, 128 routers with an ear internet connectivity, 1 year internet connectivity, 128 external drives, 2 digital cameras, 124 Bluetooth speakers, 2 giant printers, 122 solar kits, and 122 batteries. This is a lot. This is a lot.
This initiative is also expanding partnership networks by engaging public and private sector stakeholders to lay the foundation for innovative and sustainable growth.
We convened the Gambia's first ever public-private partnership dialogue focused on child rights, helping to unlock new ideas and stronger collaboration for children and young people.
Ministry of Basic and Secondary Education and a partnership with the UNICEF held public-private partnership in December to engage the public-private sector, CSOs and local organization groups to share with them the challenges and the innovative solution to some of those challenges that we are having at the sector level.
On behalf of UNICEF the Gambia, thank you to the people and government of Japan. Your generosity is not only supporting access to basic services, it is changing lives, protecting mothers, and opening new opportunities for children and adolescents across the country. Together, we are building a healthier and more hopeful future for every child. Thank you. Domo arigato gozaimasu.